So my dad used to say, don't break your arm patting yourself on the back. And while that was kind of one of those colloquialisms, those oral things that my grandmother told him and her parents probably told them, there's some real truth to that when you think about what it's getting at. It's this notion that we always sort of need to think or act or treat ourselves like we're successful, that we've accomplished something. And there's some dangers in that. And that's what I want to talk about on today's reflection. Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping leaders and decision makers navigate change with clarity. On Viral Healthcare, we explore the ideas that are spreading across the healthcare system and what it takes to implement them successfully and effectively. And that's what I want to talk about today. I want to talk about this concept of how we look at and define this notion of success when we take on a new idea, a new innovation, a new platform, a new trend, whenever we're trying to change the organization in some sort of fundamental way that takes us to a better organization, better healthcare delivery. And I want to change a little bit from what I did on Tuesday. At the podcast on Tuesday, I talked a lot about the ABCDEF Bundle in the intensive care unit, also known as the ICU Liberation Bundle, and a hugely successful activity, no matter what you look at, all the numbers, all the outcomes, all the things that are associated with it that we think about in healthcare were great. Today, I want to sort of reflect, not looking at the positive kind of things, but sort of what are the implications of how we think about success. So the question is, what is success? And success for some people might simply be awareness, that people are aware that they have a new activity, a new practice, a new way of doing things. For some, it's adoption. Yeah, people actually adopt what we're intending them to do. And adoption is a great measure of success. Another is participation. Yeah, they're using it. They're involved with what we're doing. They're participating, because there's a lot of people that are, hanging out in the background that are just apathetic about those. So that's kind of a useful thing. But where I want to aim at are real outcomes, real changes that are measurable, that have something to do with the changing organization. And it's amazing when you look back at the number of initiatives, the number of projects, the number of ideas that we've tried in healthcare over the past 10 or 20 years. A lot of them don't even reach that outcome stage. And finally, sustainability. Those are the projects that start off looking great. Maybe the first year they're doing really well, and then 5 years later, we're not even talking about them. So those are different levels and ways to think about sustainability and success and those kind of ideas. And I want to break it down a little bit and talk about sort of how people often look at these things and how we need to sort of reframe how we think about success. First of all, it's pretty ubiquitous. If you ask most executives, they'll think that they have had a lot of successful programs. I mean, it's just sort of by the nature, you have to sort of shield yourself from the cognitive dissonance of failure. And that's a theme that we talk a lot about in viral healthcare, this notion that we have to sort of embrace, we have to get close to, we have to understand and think long and hard about how failure can actually be part of the success. So let's talk about it. So first of all, how many of you have seen a successful launch? I mean, it's so amazing how much energy and time and resources organizations often put into the successful launch. I mean, sometimes it's music and sometimes it's posters and banners, and boy, it's amazing all the things that people put time and energy into on the launch. And by definition, that was a successful launch. Then there are the successful pilot. It worked in this unit or in this department or in this one portion of the organization. And that's great. That's great news that people talk about that success. And then there's like the successful presentation. Yeah, you've got a little bit of data, you got a little bit of experience, you've got a couple of areas in the hospital or the health system or in the medical group where it's working, and you just want to share it with everyone else. And then there's the webinar. This is when you teach, when you actually look like an expert because you've had maybe even just a modest amount of success. I got to tell you, I've seen, been to, watched many of those. You probably have too. No doubt, if you've been doing this healthcare executive stuff for more than 5 or 10 years, you've seen dozens and dozens of these kind of things happening. They're totally ubiquitous. Here's the real question. Do you often see or hear about organizations that talk about their failures? I mean, there's a successful launch, a lot of energy, and then if it's a failure, it just sort of drifts away. Nobody really steps up and says, this thing we tried didn't work. honestly, it didn't work. And we're going to learn from it, or here's what we learned, or here's why it didn't work, or here are the things that are going to change our organization as we think about the next initiative. I mean, here's the really interesting part about this. The staff in the organization knows it. They know it. When you come up and you say, we're going to launch this new activity and have this big launch practice and lots of discussion, lots of hoo-ha about what's going on, and then a couple of years later, nobody's using it, nobody's talking about it, it's faded away, it was one of those flash in the pans. They remember that. They think this is just the next big launch rather than the big success. And you lose a lot of credibility in that. So as we think about this idea of success, think about the long-term implications for you. And the second point I want to make is about how we measure success. And part of the reason we don't put our time and energy into outcomes or sustainability is because it costs money, because it's not easy, because we think we know it when we see it rather than really having objective evidence that it has truly changed the organization. And let me just say, if you think about the cost of failure, think about the cost of partial implementation, if you think about the opportunity costs that you might have with your organization, they're very high in many cases. And oftentimes those costs, we don't think about them, we don't measure them, we don't talk about them, but they probably justify the time and energy, and maybe even the cost of creating ways to measure how much impact we've had with our programs. So when you're thinking about the new initiative that you're talking about, you don't want to just spend time thinking about the launch. I think it's kind of useful to get everybody excited about it, to build momentum, but you need to have this honesty and the uncertainty that any significant transformational activity that you're trying to do, any way that you're trying to change the organization may not work or may only partially work, and we're going to look for that. And we want to learn from all of the things we do to make ourselves a better organization. So these are the leadership lessons I hope you get from this reflection. It's kind of interesting to think about success and being honest and authentic about the failure and the possibilities that we might fail. I'm Bruce Spurlock. That's my thing on viral healthcare. If you like these kinds of topics, let me know and come visit us on your favorite podcast platform. And I'm looking forward to our LinkedIn Live and podcast next week, where we'll interview Helen McPhee. She's a recently retired healthcare executive with great experience, lots of things that she's done well, and I think she'll be pretty honest talking about things that didn't quite work out as well as they thought. So that's my story, and I hope to see you next week.